My name is Samuel Adela, and I'm Senior Director for Health Workforce Initiatives at the MasterCard Foundation. I'm based in Toronto. The health sector in Africa requires transformation. The reason being there is a disease pattern shift, not just only communicable, we have also non-communicable diseases. We have a number of outbreaks in the continent. We have injuries and accidents. That's also one of the morbidity and mortality causes. And we also have the shift in technology and the shortage of human resource for health is unprecedented. What is paradoxical is although we have the need, according to WHO, 6.1 million health workers by 2030 that are needed by the continent, we are not hiring 30% of those who are trained. And this paradox has to be really addressed. And that gap in need means leaving many out of the service and the essential services for health. So what digital can do is to help us reimagine how we can deliver health services and to actually create equity in service provision by serving those in the remote areas using digital means by the qualified professionals. And also digital can create work opportunities for those who are unemployed. So that's also another one that I think this opportunity can help us rethink, reimagine and innovate. In the health tech space, most of the innovations are small and short-lived and very fragmented. So we need alignment with priorities of the economies and the continent, and we need also alignment on how we are investing in those areas. And because it's not because there is shortage of resources, but how resources are being deployed might have created silos, and that silos is not really helping us to achieve scale in a fast-paced manner. So I think we need a lot of coordination, political will to also organize from the public side, and private sector investment, and also development actors to use their resources to unlock resources and opportunities for young people, and that's playing a catalytic role. And that's what the MasterCard Foundation is trying to do, to really use the resources we have and the convening power we have, and also the experiences we gained in the past several months, starting from the COVID, where we involve ourselves in the health sector in a meaningful way, that unlocking opportunities and playing a catalytic role is critical. MasterCard Foundation is implementing two strategies. Number one is the Young Africa Works strategy that will enable young people in Africa to find dignified and fulfilling work by 2030. 30 million of them, and 70% will be young women. And we also do the same in indigenous communities in Canada for young people to enable them to learn and find opportunities in the economy. While we do this, we also make sure that the impact is beyond jobs. We strengthen systems so they will continue to provide the services proactively for young people. And young people are at the center, and there is inclusive growth, inclusive opportunities for young people. Inclusive in a sense for young women, for rural and those vulnerable, as well as for those disabled and who have challenges to accessing opportunities that others have in normal circumstances can access. And there are also other segments of young people who are in displaced situations and in refugee areas who also need those opportunities. And the foundation is working towards developing their skills, creating opportunities and enabling spaces for them to find dignified and fulfilling work by 2030.